Hi, this is Dr. Eckhart at Women's Therapeutic Institute. Welcome again. The last video slideshow that we saw, we talked about iodine and how most Americans are deficient in iodine and how it's important to take iodine to decrease your sensitivity to estrogen. We also talked about how to use progesterone practically to put it on the skin and how much dose that we should use every day. In this set of slides, we're going to talk about safety and also side effects of progesterone. So first of all, you have to realize that a woman makes 20 to 40 milligrams of natural progesterone in a normal menstrual cycle. And during the first day of third trimester pregnancy, a woman makes 400 milligrams of progesterone during one day of third trimester pregnancy. Remember also that natural progesterone is the same bioidentical hormone that your body makes. So it's identical. The natural progesterone that they have in my product and also other people's products is the exact same molecule that your body makes. And you can contrast this to other brand name progestins that are in the physician's desk reference that are usually prescribed by your doctor. And in the PDR, it shows that these brand name progestins may cause malignant mammary tumors in beagle dogs. And so typically what happens is that people are confused between natural progesterone and progestins. Progestins are synthetically altered natural progesterone. So you take a progesterone molecule and then you add something to it, a acetyl group or a methyl group, and then you can consider it patented. And when you consider it patented, you can then charge high expensive prices. You can hire drug reps that you pay $60,000 to $120,000 a year to give it to unsuspecting physicians. So even your physician, like I did when I first graduated from medical school, I thought natural progesterone was the same molecule as the brand name prescription progestins. And so basically I was confused. Natural progesterone is quite safe and is used by fertility MD doctors, the test tube guys, to prevent miscarriage in a test tube pregnancy. So routinely, the test tube physicians use natural progesterone to prevent a miscarriage, but they never use a brand name prescription progestin. And the reason why is that it may cause birth defects. Pro means for. Gesterone means for gestation, so progesterone means for gestation. And so you have to have adequate levels of progesterone to maintain your pregnancy. So you start off at 20 to 40 milligrams of progesterone during a normal cycle, and then when you become pregnant, the level of progesterone keeps on ramping up until you produce 400 milligrams of progesterone per day. So again, natural progesterone, as we mentioned before, is the natural hormone of pregnancy, and it's produced during pregnancy. Now it's very interesting that women that have many pregnancies have a smaller chance of endometrial cancer and breast cancer. That's well known and statistically proven in the mainstream medical field. So if you have 10 pregnancies, babies, these women tend to have high levels of not high levels, lower levels of endometrial cancer and breast cancer. So it's thought that perhaps the high levels of progesterone will help ward off or fight against these two diseases. The one danger of taking progesterone is that if you are taking progesterone to prevent miscarriage, you cannot stop suddenly, and you should be under the care of a physician. So if you stop suddenly taking progesterone to prevent miscarriage, your dropping progesterone levels will create a miscarriage. So typically a test tube doctor, one of those test tube doctors, will give you progesterone on a periodic basis, And you must make sure that you continue to take progesterone on a periodic basis. There might be injections, it might be topical, it might be a vaginal or rectal suppository or oral progesterone, but you have to make sure that you take it periodically all the time. If you stop suddenly, your dropping progesterone levels will create a miscarriages, so that is a danger. Now, I've had two women that were not under my care, but I just heard of their stories, and they had a brain cancer, a meningioma. One was a meningioma, and the other one was a brain cancer in the center of the brain near the optic chiasma. And these two women, they were not taking progesterone, but they just happened to be two patients. It seemed that their cancers got worse during pregnancy. So it may be that progesterone will slightly suppress their immune system. Again, a baby is kind of like a foreign body, and it's growing in your body, and progesterone may slightly suppress the immune system. So the progesterone might be good for autoimmune diseases, such as a mild disease such as mild lupus. So if you read John Lee's book, What Your Doctor May Not Tell You About Menopause, he makes mention of the fact that mild autoimmune diseases may be helped by progesterone. But again, these are anecdotal stories. There's been no real testing clinically on this, but I did have some women report the same thing as well. So Mercola has also said that if you take too much progesterone, there's a danger of building up in the fat with mental confusion. And so at topical doses of 200 milligrams a day or greater, this might be too much and build up in the fat. But personally, I have never seen this in the 15,000 patients I've had in the last 10 years, starting from 1999. I'm at 20 to 60 milligrams a day. I have never seen this. I had one compounding pharmacist that I was talking to on one of the leading compounding pharmacies in the country, and he was telling me that he saw two patients that had mental confusion with high levels of progesterone per day. But then again, I did not examine them. I did not see them. This is just by hearsay. Out of the 15,000 patients of the last 10 years that I've had, I have not seen one case of mental confusion at 20 to 60 milligrams per day. So in general, natural progesterone is quite safe. It's probably safer than acetaminophen or aspirin. If the therapeutic range is quite wide. The therapeutic range can vary anywhere between 20 to 400 milligrams a day. If you are taking progesterone to prevent miscarriage, make sure that you are seeing a physician, and remember that you cannot stop the progesterone suddenly, otherwise dropping progesterone levels will create a miscarriage. So let's talk about side effects of natural progesterone. And I would say that in our patients, if you do not cut out xenoestrogens, taking progesterone will make you temporarily worse. And that means that if you take the progesterone, you will actually feel temporarily worse. So you go to the progesterone forums, and there are women who say, progesterone, this is the best thing since sliced bread. I feel so much better. The bloating, the breast tenderness has gone down. I just feel great with this progesterone. And then you go to the same forum, and in the same forum there are women who say, well, I hate this progesterone. It's the worst thing that has happened to me. I take it again. My headache is worse. My bloating is worse. My breast tenderness is worse. What's the deal here? And so it turns out that what is going on here? It turns out that chronic xenoestrogen intake can cause sleepy estrogen receptors. So most women in America were using things on their skin that have some kind of herb or chemical in it that's estrogenic. And when these herbs or chemicals go into the body, this chronic estrogen exposure causes your estrogen receptors to be sleepy. And so what happens is progesterone wakes up the sleepy estrogen receptors, and then you get more estrogen dominant, and you go, damn progesterone, it's a damn progesterone's fault, I hate progesterone, progesterone's the worst possible thing you could possibly use, I'll never use it again. So it's kind of like a rock concert. When you first go to a rock concert, initially the rock concert sounds very loud within the first 5 minutes. And then after about half an hour, it doesn't seem so loud anymore. Then you take the progesterone, all of a sudden the rock concert's loud again. Okay, so this is what's happening. It's not the progesterone, but it's the waking up of the sleepy estrogen receptors that makes you look like you're more estrogen dominant. So the solution is to cut out xenoestrogens for 1 to 3 months and then take progesterone. Many of the things that you put on the skin that have these herbs or chemicals in them that are estrogenic are fat soluble. So when you put them on your skin, they may last for 1 to 3 months. So for an example, have you heard about LSD, the drug of abuse? And you know that 10 years later you can have a bad trip? Well, the reason why is that LSD is fat soluble. And LSD is stored in the fat. And then when you have 10 years later, when you have a flu, or you don't eat for a couple days, the fat gets metabolized. And since LSD is active at very small amounts, the LSD is released when that fat gets metabolized, and then you have a bad trip. So you need to cut out xenoestrogens for 1 to 3 months, and then take the progesterone for these 40% of the women who take progesterone and get worse. It's this paradoxical effect of xenoestrogens. Another side effect is if you take progesterone before you ovulate, the ovaries will think you're pregnant and not ovulate. So in other words, if you take progesterone the day of ovulation, where day 1 is the first day of your period, okay, and then at day 14, as you count, day 14, so day 1 is the first day of your period, day 14 is when you would ovulate. And if you take progesterone before you ovulate, the ovaries will look at the progesterone levels and think that you're pregnant, and they won't ovulate. So taking progesterone before you ovulate can prevent ovulation. This suppression of ovulation can actually be used to give the ovaries a rest for a couple months and then promote fertility later on. For details on how John Lee did this with his patients, you go to look at www.happypregnant.com. So what you can do is you can suppress ovulation for a couple months and then spring off the progesterone. If there's any follicles left, they'll come up and ovulate. This is especially useful for women after the age of 35, where most of the cycles that they have, but not all of the cycles, are anovulatory, meaning they don't ovulate during those cycles. So they'll have a period and a cycle, but no ovulation occurs. The follicles just come up. They're supposed to pop out an egg, but instead of popping out an egg, the follicles just go back down. So again, the side effects of progesterone, if you don't cut out the xenoestrogens, 40% of the women will actually have a temporary increase in this estrogen dominant symptoms, and that's because the progesterone wakes up the sleepy estrogen receptors. Again, if you take progesterone before you ovulate, the ovaries will think you're pregnant and not ovulate. But this effect can actually be used to increase fertility, especially for women after the age of 35. Okay, so thank you. This is Dr. Eckhart for Women's Therapeutic Institute. And the next set of slides we'll talk about is topical versus oral progesterone and why we like that, and also about hormone testing. Okay, so thank you very much for joining us. This is Dr. Eckhart with Women's Therapeutic Institute, Natural Progesterone.